Hello. Today I'll be talking about the prototype that I've created in regards to my healthcare organization, specifically Planned Parenthood. So, using Figma, I kind of generated this prototype of an app of the mobile clinic that I proposed as my tangible solution in regards to dealing with the overall satisfaction of user experience at Planned Parenthood. So before I kind of go into the prototyping of the app, I think it's really important to kind of just go over back into the Miro board and kind of highlight the key focal points that I really wanted to focus on in terms of what the app provides and how it's intertwined with the long-term solution that I feel Planned Parenthood can really utilize in terms of making their user satisfaction just a little bit better and improve it. So, kind of going over last week's assignment in terms of our solution. I know that I had mentioned a mobile clinic in which I feel is a really good temporal solution in terms of providing quick and efficient services for communities that otherwise lack in clinic locations, or just in general for communities that are historically marginalized or lack overall resources. And this mobile clinic I felt is more catered for individuals who kind of have that fear and associate stigma with Planned Parenthood. So overall, kind of just highlighting once again some of the key focal points that I really wanted to focus on in terms of user satisfaction was the barriers that kind of hinder patients from feeling fully satisfied with their service every single time. So logisticals and sociocultural and financial reasons. And kind of intertwining all three of these reasons into a tangible solution, which was the mobile clinic. And so now going back to Figma, I felt like a good tangible solution to all of this was an app. And while you might be thinking, well, Planned Parenthood should already have an app, and they do have an app, but after reading a lot of the reviews of the app and working around from it in a first person perspective, I think there's a room for a lot of areas of improvement. And moreover, there isn't a tangible app for California, much less one for a mobile clinic. And so I feel like incorporating all of these areas of improvement into one feasible app is definitely a starting point, at least, for kind of generating more room for improvement and just ways to really work around what my idea is really on. So, kind of getting into it, using the same logo that Planned Parenthood is associated with, I really wanted to be authentic and as precise as possible. So, obviously, getting factual and correct and accurate services that they are providing rather than, providing services that, in my opinion, would be in a way I wish the services that I wish that they provided, but I want to be realistic in this sense, and hopefully in the near future they provide more realistic services. Not realistic, but services that are a bit more feasible and are a bit more accessible to everybody, without so many restrictions. So going into it, I really wanted the main focal points to emphasize how this app is for Californians, just to start off, really, and get an overall feel on how it can progress and then work around. Because I feel like in California, that's such a rich and diverse state that having such a diverse population would really allow for a lot of nicks and differences and changes, consecutive changes to be made throughout the time of the prototyping phase. And so, how I mentioned, I think I wanted the main kind of description to really be the focal point, such as the types of services that are provided, what can be accessed, and kind of incorporating a mixture of in-clinic and outpatient services into one. Because judging from the mobile clinics that there are available at Planned Parenthood, there's very few in general, but most of their mobile clinics kind of provide very basic but also very necessary services. So, as I mentioned, I feel like this app would really benefit in providing users daily updates on clinic locations, whether or not clinics move around or if they stay at one exact location kind of differs on the providers and the healthcare organization from my pre-existing knowledge. So also as well providing relevant services that they may be servicing, wait times that may occur, just so that people have a basic understanding of what they might be getting into, whether or not they have prior commitments beforehand, or if they have somewhere to be, or just an estimated time on how much they think they'll be waiting, as well as providers, whether or not they have a preferred provider in mind and they would like to go see them, medications that they can access, and as well as resources. And then the following are just types of services, information, resources that they can really receive. And these are all, of course, taken from their website, from previous apps and prototyping that I had also seen. So I try to make it, as I mentioned, as accurate as possible. So here we have receive pre and post appointment education, important information regarding their appointments, their vitals, logging any symptoms that they may have, and medications that they may be receiving or had received in the past. Important updates regarding relevant policy changes in their state or county. This is an additive that I feel like would be really beneficial to add, just because I know that although we're talking about California, which is historically an extremely liberal state and really expressive with reproductive rights and sexual health, I think nonetheless it's still really important to provide information regarding sexual health and its ever-changing effects and accessibility post Roe v. Wade. So I also mentioned adding updates relating to free healthcare services and other low-cost services, whether or not they're Planned Parenthood associated. And then finally, accessing resources, brochures, and guides of frequently asked questions regarding sexual health. So, of course, information taken from their website and being as factual as possible. And so I added some subcomponents to their app, more specifically the popular services and what they would kind of entail. So the four main being family counseling, STI, HIV, pregnancy testing, the morning after pill, also known as Ella, and then their abortion options, whether they're at home or in clinic. And so for the logos, I really wanted them to be not just eye-catching, but kind of have somewhat of a cohesive theme. Right now, judging from the color scheme, they are really up to reform, I would say. But for the most part, I really try to align them based on the relevancy to the title and just the overall feel that they can provide users. And so I put family counseling as the first one, and I mentioned the family planning benefit program, which is a pretty popular program for Planned Parenthood users. They tend to apply there to receive information regarding the services, coverage, whether it's covered under their insurance. Let's see. I had more information, but it seems like it was cut off. Um, and overall, just a better feel on the amount of support that they could receive post pregnancy and for family planning. Then we have STI, HIV, and pregnancy testing, which are all pretty popular services used at Planned Parenthood. So, users here can get updates on results, order medications, or talk to a provider via telehealth. So, that I feel like this is a really great way at normalizing accessibility, better yet, normalizing users feeling open to talk to their providers without like fearing going to the clinic and having to say, I am here for this blank reasons, which, of course, regardless, it's a healthcare clinic. And while most healthcare professionals don't mind or wouldn't really care at all what the user or patient is there for, I think putting myself in a patient perspective, I can understand that hesitation for wanting to go and see a provider regarding results that may be a little bit varying. So I think providing the option of talking to a provider via telehealth is a great option to provide on the app, as well as learning next steps, whether it be from counseling or any resources that are available regarding any results. The next portion that I'll be mentioning is a morning after pill, which is LS. So here, patients can order medication to their home, which is anonymous, but the only defect being that it takes around 5 days, which in turn wouldn't really be beneficial since the morning after pill is suggested to be taken 72 hours after unprotected sex. But of course, this is completely up to the user whether or not they're planning on something in the future, or they would just like to have one in mind. And then obviously learning about any potential health centers that offer the morning after pill for a quicker picker up, for in case they wanted easier access to their services. And then, of course, it was cut off, but learning about whether or not they're covered under their insurance for less expensive care. Because I know the morning after pill can be a little bit expensive, especially for people who are uninsured. So I think it's a great way to just get an overall estimation on whether or not their health care covers them. And then finally, abortion options. So this being one of the really popular options that is covered under or provided by Planned Parenthood. So I feel like having this being one of the main focal points as well is really important and crucial, especially in providing more awareness about abortion, regardless of anybody's opinion in regards to their alignment with abortion options. So I think here really focusing on learning about whether one would qualify for an in-clinic or at-home abortion pill, which is roughly taken between 1 to 10 weeks, but still learning about their options, as well as learning about in-clinic locations regarding post 10-week options. Also learning about any, in particular your state, but any state's restrictions and policies, and kind of putting themselves in a what if position. So I feel like this would be really helpful, especially for individuals who might live in parts of other states and they want to kind of put themselves in a situation where they would see what state covers them and if they're at the capacity to do so to access an abortion in this particular state. And so, just kind of tying this all together, I feel like these being one of the main focal points in terms of services, and uh, later on, obviously, prototyping more with other subcomponents, such as making the brochures, translating this into multiple languages to make it more accessible. I think one of the main things that I really want to focus on in terms of my prototype is just really accessibility, and how can making things really easy to understand, easy to use, can contribute to better overall user satisfaction. Because judging from reviews from the previous applications that they have in the App Store, you can tell right away that it's really low uh, dissatisfaction, or just dissatisfaction in general, just because of how hard their apps are to use, and which in turn really discourages users from continuing using Planned Parenthood apps. So I feel like making an app that is really accessible and just easy to use, great resource, is the focal point of my project. So I want to thank you for hearing me so far, and hope you enjoy the rest of your day. Thank you.